China took further steps to ease its COVID restrictions by introducing 10 new guidelines on December the 7th. The new rules stipulate that nucleic acid tests are no longer mandatory to, for example, enter malls or travel across cities. And those who test positive for COVID-19 with mild or no symptoms are allowed to quarantine at home. This expands on the 20 measures listed by the State Council only last month. How do we understand the new policies? Will China see a sudden surge in cases or even deaths? How should people overcome their fear of getting COVID-19? Today, I'm pleased to be joined in this special edition of The Point with me, Li Xin, from Beijing by Professor Li Guangxi, member of China's State Council Joint Prevention and Control Mechanism and director of the Pulmonary Division at Guangxi Hospital of the China Academy of Chinese Medical Science. Professor Li, welcome to The Point. The biggest question a lot of people have right now is, will China see a huge surge in the number of cases, and how soon will it be if that is the case?
Yeah, in my opinion, in my experience, so once the mild symptom and, for example, if we do not do the nucleic acid test, then we cannot figure out who had a mild symptom or no symptom. Those patients will not be picked up from the general population. So that will certainly cause a surge of the new infected patients. However, like what you said, the death rate will surge. I don't believe so.
So you don't think there will be a big surge in cases?
The big surge in case, that's for sure, but not the death.
Why
surge.
not?
So, according to our experience, especially, Chinese government already see the data. We will see less and less severe cases in the past 3 years. So we already accumulated the data, and we already find some solution to deal with the severe people and how to prevent the patients deteriorate. So all these measures will be taken in the next several months.
What kind of methods do you mean in treating COVID? For instance, we understand that according to an article published by one of the most leading medical journals, Nature Medicine, it says that from May of 2020, which is after the severe, the outbreak in Wuhan, to February 2022, earlier this year, only 2 people died in China out of some 24,000. So how is this possible? How credible is this number?
Yeah, because, previously our policy is, once it's very strict, you know that, so we want to do the zero COVID policy. We stick to that, and then we will not cause so many people infected by COVID-19. So then we certainly can control the mortality, and we have enough healthcare resource to take care of all the severe patients. So that's what we have done in the past 2 to 3 years. And at the same time, we are closely watching how the mortality rate change, how the severity of the COVID-19 change. So, in my opinion, it's just like a ripple. I call that a ripple effect. Like when you drop a stone into the water, and in the initial circle, it will be very strong. So that will push quite a lot of vulnerable population to death. However, in the last circle, so when it is chain mutation, the virus continuously mutated. So in the last session, the last circle, the ripple will become very, very light, and it will diminish in the water. So
some people are saying it is random. that the virus will mutate this way or that. What is your understanding from a clinical point of view? Is it still possible that with more Chinese being infected, the virus will have the environment to mutate and potentially become more lethal?
Oh, so that's a very good question. So in the past, several thousand years, according to all the, in China, medical history, epidemic history, what we have seen is, all the pandemic will become less and less severe. So that's how our population survive in all the pandemics. Like what you said, if the virus mutated randomly, that that we can hardly survive in the earth. So I think that's a possible mechanism of the virus, why the virus wants to survive. If they mutated to another direction, it can cause more people die. And then we certainly know the severe strain of the virus. Then we will isolate the population from the other population. So then the virus will stop to spread.
How do you look at some of the observation thinking that China wasted quite some time, or that China should have adopted, the new measures much earlier? Do you think the past 3 years, the efforts that China saved a lot of people? I mean, this is undeniable, but do you think time were wasted? The efforts were not necessary?
I think in the past 3 years, we have gained very successful results, especially in the initial stage. Once the virus come to the world, it was very severe. It can trigger the people's cytokine storm, could cause acute lung injury, and it will make hospital, especially for the ICU beds, occupied. It happened everywhere in the world. But I think at that time in China, our Chinese government, we did the very successful measures. We control the COVID-19 cases. We did the zero COVID policy. That's the reason why we had very few people die. And now, once the virus become much, not so severe, become very mild, and at this time, we want to ease our measures, and we want reopen our country. Then we will certainly have some surge of the new cases. However, the mortality rate, the severe type of COVID-19 will become much less than before. So we will get very, very successful result. I believe so. We will not lose any life, any excess deaths in the next couple of months. I think in some other journals in the foreign countries, they said, if China ease a measure in this winter, we will, maybe 1 million people died from the COVID-19. But I don't believe so.
What is your take?
Yeah, because they only think about our vaccination rate, the antivirus, the medicine efficacy. But however, they forgot one thing: we have Chinese medicine for many years, and we successfully using Chinese medicine to save quite a lot of people in the past several thousand years. So we accumulate a lot of experience on that.
For the hospitals now, what is the challenge? Because a lot of people may not be dying from or may not be suffering from the infection or the virus, but they are suffering from anxiety, and hospitals may be overwhelmed because of that. What is happening to your hospital, and how do you suggest to the general public what to do at this moment?
Yeah, like what you said, the people they are anxious. They are not catching any COVID-19, but they want to go to the hospital to buy a lot of cold medicine, to buy the fever reducer. So that's the reason we don't have any fever reducer right now in our hospital. So that's very strange. The people, they are really, really nervous about the fever. However, in our hospital ward, we had quite a lot of vacancies. We had much less patient occupied compared to the same time last year. So that's,
Why is that? Why is that? Is it because people are not allowed, not so many people are allowed to enter the hospital because a lot of tests are not available, or a lot of people are testing positive? Or is it because the number of severe cases are just not that much?
No, I think there are two reasons. One reason is because, in the past several years, we took a lot of measures, and the people wear the mask, and the infection, disease is getting less and less. So then the elderly people was protected from the infection. So the exacerbation of their chronic conditions was not so severe like the previous years. So that's the reason why, like in our respiratory wards, we had, we very rarely see, acute exacerbation of COPD, acute exacerbation of IPF and pneumonia. These are all much less than last several years. And another thing is quite a lot of people, if they had a baseline condition exacerbation, they don't want to go to the hospital. They are afraid to catch COVID-19 in the hospital, because the hospital is very dangerous, certainly. In the future, in the next few months, quite a large proportion of, our residents will get, positive COVID-19. Maybe not everyone have symptoms, but some people will get fever, and some, elderly people, some vulnerable patient may get a low grade of fever. So that's my opinion. So then they may go to the hospital. If
does the hospital have enough capacity? Yeah, does the hospitals have enough capacity for that? Because the numbers suggest that China's ICU beds is only 4 out of 100,000, much lower than developed countries. That is also the reason why people are fearing a possible surge of deaths because of COVID.
Yeah, so, like I always mentioned, in the past 3 years, the death rate is going down with the different mutations, especially once this, new mutation, Omicron. So the mortality rate and the severity rate is already very, very low. It's even lower than the seasonal influenza. So the patients requiring ICU beds, requiring intensive care will not be as many as we cannot handle.
But the number of people who may get infected are larger.
Yeah,
are you not concerned about that?
I understand, but like what you mentioned, the spread of the virus still needs some time. It doesn't mean that all the Chinese population, 1.4 billion people, will get COVID-19 at the same time. So I don't think the number is correct. And I think, all of Chinese physicians can handle that.
So how do you describe China's approach now? It seems that China is still trying as best as it can to keep the infection low, and the process of people getting infected long. Do you see that as what is being done now, instead of trying to bring the number to absolute zero?
Yeah. So yes, that's a very important issue. Right now, we are trying to ease the measures, and we are also watching carefully about the number infected and about the patients who need the intensive care. So like what you mentioned, a lot of patients will get fever, and the fever causes people, they may think they have, they may need the intensive care, but who will need the intensive care? This depends on the physician. So in my opinion, in our physician's opinion, only the patients induced by the COVID-19 get acute lung injury. So they may need the, in the initial stage in 2020, in the January in Wuhan, quite a large population, they had a desaturation of their blood. You understand?
How do people know that? So this is the issue here, because right now people have no idea to what degree, to what extent should they stay at home, and when must they go to hospital? How can people find out by themselves?
Yeah, that's what the Chinese government is pushing some online guidance, and we also I'm also writing quite a lot of papers in the public the public medium, and to advocate people how they treat themselves at home, so not to go to the hospital in case the healthcare resources occupied. So I think we also need some time to do that. So, but we already have all the measures to do it. So
people are lining up. Yeah, people are lining up in front of pharmacies or buying up, medicines, whether traditional Chinese or Western medicine that can help them cure fever or potentially COVID. Are they doing, what else can they do? I mean, to find out exactly whether they need hospital care instead of just staying at home.
Yeah, I think quite a lot of people are afraid of fever, and they go to buy the fever reducer. Whatever Chinese medicine or Western medicine, they only want to reduce their fever once they are at home. The fever really can make people uncomfortable, but in our data, we have seen most people can recover after 1 or 3 days fever, they will recover automatically. It's a self-limited disease. It's not a very severe. So the only thing is a patient who get desaturation. So that's the reason why we ask people to not buy the oxygen generator. We want them to buy the pulse oximeter. So to watch if they had some desaturation, especially for this vulnerable population.
In Chinese, 血氧浓度监测仪是吗?
Yes, pulse oximeter. Okay. So that's the 血氧监测仪. So the people can watch their pulse oximeter. If it's lower than 95%, they certainly can call the hospital and they can go to the emergency room or fever clinic, or even the regular hospital ward. So I think in the future, in our hospital ward, we will not, refuse any COVID-19 patients. We'll take care of them,
But yours is a specialized hospital, isn't it? I mean,
no,
Guangxi Hospital, you're a general hospital. You have all kinds of patients.
Yeah, we have all kinds of people, all kinds of patients. We are general, the Chinese medicine hospital, but we also use the Western medicine. We take care of patients.
But are you not afraid that people who have vulnerable conditions such as cancer, but because your hospital is also treating COVID patients, that the virus can spread in the hospital? Are you not afraid of that?
Yeah, no, we are not afraid of that. And we already see some of that. We see the cancer patients catch COVID-19, but they have less symptoms than the younger population. That's what we have seen. So because their immunization, the capacity is lower, so they don't create too much, fever and immune reaction. And we also have quite a lot of Chinese medicine to help the vulnerable population, like ginseng, to boost their energy, to help them to boost their immunization capacity.
Okay, finally, although it's going to take time for vaccination to work and for people to be fully vaccinated, but as we discussed, China is trying to flatten the curve or keep, the infection rate as slow as possible. So there is going to be a window of opportunity for people to develop immunity either through vaccination or infection. What do you say to that?
Yeah, the flattener curve is our ideal, thinking about that. In my opinion, the surge will happen. in the next 1 month. So this cannot be stopped by any measures. So since we already believe that the mortality rate is becoming less and is very, very low, is even lower than the seasonal influenza. So we are very confident about anything happen, and we believe that the COVID-19 will not become big problem. But at the same time, we want to watch seasonal influenza and like RSV for the children. So that will be another big issue because in the past 3 years, quite a lot of people, they don't have even any flu. No, they don't have any fever. So their immunity is becoming less stronger, much less stronger than before. So then they may catch the seasonal influenza, they may catch any other virus like or some bacterial infections. So we need to watch that at the same time.
Do you think there are any other things, important things you would like to highlight?
Yeah, I think another very important thing is regarding the severe type of COVID-19. It's we need educate the population. The severe type of COVID-19 was not caused only by the virus itself. It doesn't mean the virus will kill you. It's because virus trigger the cytokine storm by your immune function. Then the cytokine storm will give you a big harm. So that's the reason our Chinese medicine can help multi-target to stop the cytokine storm, especially for this vulnerable population. So that's the reason we are so confident we will not lose so many Chinese lives, especially those the vulnerable population. We will still have the best result in this anti-pandemic war.
Okay, before people get severe, before the symptoms become too severe that they have to go and to be treated in hospital, what can be done at home with what we have? That they don't have to go on the mountains and harvest herbs. What simple, useful tools people can do? You mentioned ginger just now. What else can be done?
Ginger is, can help you to reduce the fever for sure. But the ginseng, like what I mean is the ginseng. Ginseng can also help the elderly population, help the vulnerable population to boost their energy.
Okay.
And another very important
ginseng, any type of ginseng?
Chinese ginseng. I don't think the Western ginseng. Yeah, Chinese ginseng. That's planted in Chiangmai Mountain. So that's the best ginseng in the world. And at the same time, we want people to keep the healthy lifestyle, to sleep early, to have enough sleep, and don't have cold. If you have cold right now, then you probably will. Yeah, when you catch cold, you probably will have some kind of fever, very high fever, after you get COVID-19. So that's what I have seen in the past week. So the people get COVID-19 and at the same time they catch cold. And then they have positive result and they have very high fever.
Some people are even saying alcohol. Drinking a small amount of alcohol may help. Does that have any scientific?
I don't think there's any scientific data to show that alcohol will help people to, against COVID-19. Don't do that. Alcohol is not so good for people's health.
That was Professor Li Guangxi, member of China's State Council Joint Prevention and Control Mechanism and director of the Pulmonary Division at Guangxi Hospital of the China Academy of Chinese Medical Science.